welcome to this podcast segment dedicated to alumni in the healthcare field. Today I'm joined with Dr. Curtabuke, who will give us some insight on his career and how being a student at Academy prepared him for it. Before we dive into the questions, would you mind briefly introducing yourself and telling us what class year you graduated, how long you were at Academy, and what you were involved in when you were here?
Sure. So my name is Richard Curtabuke. So I'm a general internist at Cleveland Clinic. I graduated from Columbus Academy in 2005, and I joined in second grade. So that would be, 11 years, I guess, that I was there. Well, I guess now they're pre-K and kindergarten, too. We didn't have that back when I was there. So while there, I was involved with the band. I was involved with baseball as well as bowling, and then obviously a bunch of other pursuits as well, which we'll probably get into during this conversation.
Okay, so what is your current title and place of work?
So unfortunately in medicine, we have a lot of different titles and different hats that we wear. So the couple titles that I have, so I'm an attending physician at Cleveland Clinic in the Department of General Internal Medicine and Geriatrics. I also have an appointment in our Department of Executive Health. And then I'm also the medical director of Health Network Foundation, which is a foundation that helps connect executives around the country with different healthcare institutions, which is actually based in Cleveland.
In a couple of sentences, how would you describe what you do?
Tough probably to describe medicine in a couple of sentences. I would say, so I see patients in both the inpatient and the outpatient setting. So very similar to those who have a primary care physician. I serve in that capacity for about 2,500 patients. And then 10 weeks a year, I actually work as what we consider a hospitalist, where I'm on our inpatient service and I get to teach medical students and residents.
And how many patients would you say that you see per day?
So the way that I think about it is slots. So the way that we operate is they're 20-minute visits, and I would see 12 slots per half day, but sometimes those slots would be 40 minutes long if you were there for a full physical. And that way we do something more comprehensively in terms of looking at preventative care for your overall health. So I would say it depends. Sometimes it's 10 patients a day, which I would say is probably on the higher end in like a half day setting. And then if you think of when I work with learners, so if I have residents with me, if I have medical students with me, those are actually templated in where they actually try to protect time for education. Okay. So not only then would we see patients, we would do obviously teaching in terms of physical exam findings, evidence-based medicine, just talking through the different treatment modalities we could offer. And so that takes more time. So usually what they do is they actually have us see 6 or 7 patients in a half day just to allow for that extra time.
About how many students do you typically have?
So typically if it's a medical student, and I work with first year, second year, and third year medical students typically, I would just have one with me in the outpatient setting. When it's residents in the outpatient setting, I actually usually supervise 3 or 4 at a time. And then when I'm on the inpatient setting, typically the structure is you have one senior resident, one intern, which would be a first year resident, and then a medical student, usually is a third or a fourth year medical student.
Wow. So back to Academy, where did you go for your post-Academy degrees? And did you feel like Academy did a good job of preparing you for success at that school?
Yes, so great questions. So for me, Case Western Reserve University was where I matriculated. The reason that I was interested would be potentially the opportunity to play baseball there. So that was something that I had been interested in. The other thing was obviously all of us consider financial aid packages, considering how expensive secondary education is. So that was, I think, one of the big reasons that I chose Case Western. So Academy prepared me in a lot of different ways. One of the nice things, right, is there's a lot of opportunity for advanced placement credit.
Yes.
So Case Western was actually one of the more liberal schools in terms of allowing credit to transfer into kind of your collegiate career. So actually, essentially, I was starting off as kind of a late sophomore. You think about it in, a 4-year degree.
Yeah.
So I was actually able to get my degree in history in 2 years at Case Western.
Oh, wow.
So when I graduated in 2005, I would have been graduating from Case in 2007. But they have a unique program there. It's called the Integrated Studies Program. So that actually allows you to get a master's level degree then in your second 2 years, because some of the credit actually counts in both areas. So what I decided to do is actually get my master's in history, concentrating actually in STEM, so science, technology, the environment, and medicine, with really a concentration in medical history. And I actually fully had the intention to become a high school history teacher.
Oh,
And
wow.
we can talk a little bit more about the
Okay.
interest there. But ultimately, while I was there for the 4 years, Case Western, as you can imagine, right, a very engineering and science-oriented school. So I had enough credit actually to also get my of Science in biology, as well as a minor in chemistry.
Oh, wow. So did you not follow the traditional pre-med track,
So I
or?
did not actually.
That's really interesting. That's
Yeah,
cool.
so when I graduated, and that would have obviously been 2009, I had my Master of Arts in History, my Bachelor of Science in Biology, and then my Bachelor of Arts in History.
All right, so then what attracted you to pursue medicine and internal medicine when you were so interested in history?
So I had already had a background in science. Biology was something I had been interested in, and really I had always been interested in medical history. So a lot of the things, A Brief History of Germs is a great book if you have not yet read it, but there are a lot of things out there that I think are tangential to medicine and history. So one of the things that I knew I always wanted to pursue was at least my interest in medicine from that perspective. When I was looking at job prospects in education, someone had kind of casually mentioned challenging, at least in the environment that I grew up in, to potentially get a job with a history degree right out of college. So they said you might want to entertain other things just to kind of cover your bases in case that doesn't work out for you. So one of the things that I did was apply to both law school and to medical school because I was still undecided at that point even, and had done well enough at least on the qualifying exams for both, where I decided to pursue medicine at that point. And I think for me, I was still unsure, I think, because the first 2 years of medical school are very much like college, where the education is still testing based, showing up for exams, more of a classroom environment. And I think it really wasn't until I had more significant patient interactions during my 3rd year of medical school that I really had fully said, this is the decision that I'm glad that I made. And then from there, I think it really solidified my career, and medicine was kind of an aspect of that. We can talk more about how I decided on medicine ultimately as well as we go through this.
All right, that's great because I feel like more times than not now, a lot of people expect students to know what they want to do when they're like 18 or 19, but it's really interesting to see how different passions can take you somewhere that you wouldn't have pictured yourself being in.
Often, we describe careers, and you probably have heard this expression before, as corporate ladder, right, where you go up and down.
Yeah.
I think the more that I do this, and especially I think in particular internal medicine, I think of your career as more of a jungle gym, where it's not necessarily up and down, where one spot is necessarily better than another. I think it's just different interests take you in different directions, and I think that you can really reinvent your career at different points depending on the things that are meaningful to you. So if it's young kids and a family that you want, there's the opportunity, right, to step back and to put more time and effort into that.
Yeah.
There are certainly tons of things in medicine that you can pursue, not only from an educational perspective, and that's one of the reasons, as you heard from my introduction, that I'm involved with resident and medical student education, because as you kind of heard, right, education was always something I wanted to go into.
Yeah.
So I think one of the things that really attracted me about general medicine was so many educators in medicine are general internists. So one of the things that was really nice about this is I would have the opportunity for education even, as a physician. And that's something that I was always passionate about, and one of the reasons that I had considered pursuing, a career in education from the history perspective.
So looking back at your time at Academy, were there specific skills that you learned or things that you learned that helped on your journey?
The junior speeches, I think, are a really unique opportunity that Academy students have that you don't necessarily get in other public education forums. And I think one of the big things, and even now I would say, that is really important in any aspect, of the medical career, but I think really any career you go into, is communication. So I think both written and just oratory communication is critical. Because imagine being in a room with a patient. If you're not able to communicate all of the knowledge that you have in terms of the diseases that they have or the treatments that are available, it's really lost on that person and they won't necessarily get the direct benefit of that. So I think communication for me is really the key. And I think Academy was the place that I really learned how to communicate with others, both in the small classroom projects that you guys work on, just collaboration, I think, with peers, as well as faculty. And I think one of the really nice things is you are afforded the opportunity to do more public speaking through the junior speeches. And I think that gave me a lot of confidence moving forward into college and then beyond, where, I think I'm more comfortable in those environments than I would be otherwise, just because you start developing those skills early on. The other thing I would say is critical thinking skills. I think one of the big things that we're facing as, obviously our generation, but I think even more than that, well, I guess I can't put you in our generation, but I would say that we are facing, right, as a population, are really complex problems.
True.
And I think, as you move through high school and as you move through college, you have to know the basics to be able to be at the table for conversations like that. But the basics, right, are only going to get you so far. I think you have to be able to think differently about problems.
Yeah.
And that's something I think that Academy really afforded you, was it's not just what's the answer to this equation or what's the right answer to this question. Because I think as you start to get older, and particularly in medicine, as there's a huge area, right, that's not evidence-based, that really doesn't have a true answer, you have to start thinking about, well, there's a spectrum of correct answers, and where do you want to be on that spectrum is probably how much, that you need to think about this critically and consider the patient, consider socioeconomic factors that may be contributing, think about, new evidence that may be presented. And I think you're just continually learning and making those decisions. And that's what I think Academy provides for you, is really that foundation to say, how do I think about problems? And then when I'm presented with new information, how do I incorporate that information into my decision making?
Yeah, I definitely agree with that, because even now in many of my classes, especially math class, when we're going over problems, the teacher always asks different questions like, what if we change this about this problem? How would that change the entire answer? And so I think it's really interesting to look at a problem that might seem to only have one solution, but with different perspectives, and that might open up different ways to think about it.
Yeah, and I would say that's something that you evolve, right? I think it's more sophisticated as you get more specialized in the thing that you're going to do for the rest of your life. Because right now, right, I don't think I've done calculus or even could point you in the right direction, right, in a number of years. But obviously those skills are still applicable in terms of, how to approach that. So I think the exact question you just posed is very apropos for what we're talking about, where, yeah, if you change some of these variables, what would that look like? And right at its core, that truly is some of the things that you're learning in high school.
So going back to your work and your career, what is something that you would say surprises people, or something that stands out about being an internal medicine physician?
I would say the thing that's most interesting and surprising to me is just the stories that you hear from the patients that you take care of. And I think not only from what they're involved in from a professional standpoint, but you really get to know their lives. Where, this is my 8th year here at Cleveland Clinic, so I've had patients, who I've seen for the past 8 years go from, single adults to getting married, having a family, to seeing aged loved ones, pass away, or to move into their house where they're caring for them. And so I think you see a lot of these stories, and, successes, failures, and it's just really fun, I think, getting to know them on that level. And I think it's a privilege, right? Just them sharing those aspects of their life with you and being able to be a part of that and to try to do your best to keep them healthy so they can do those activities that they enjoy. The one story I like to tell, so one of my patients who I actually just saw recently is involved in really high level, scary venues for Halloween. Dresses up like professionally, gets makeup done, and has a variety of costumes that he will wear. And he was really looking forward, obviously, to last year, but unfortunately the COVID pandemic, a lot of those things from happening live and in person. And so he was just kind of talking about his disappointment and how this is something that he looks forward to, year after year after year. And this is the first time actually in 50 years that he will not have done this because obviously of the pandemic. So if you think about that, I mean, it's such a huge aspect of his life that, I think it really took an emotional and mental toll on him. And we really spent a lot of time there kind of discussing, what that felt like and how he's coping and what his hopes are for this year, with the vaccination and how that will evolve. So just really interesting having those discussions.
Yeah, that also just seems like a very rewarding part of what you do that many others in different career fields might not be able to experience on the same level.
Yeah, and I think medicine is unique in a lot of ways. And I think that's why people are attracted to it. But I think it really does afford you just a different perspective.
So what are some of the biggest challenges that you are facing or have faced in your current role? And what are some struggles that you might anticipate in the next year or 5 years, et cetera?
I think a few things that we've already seen, right, with the disruption of obviously patient care in person. When patients need to come in, right, it's still appropriate to bring them in. But COVID has really changed the way that we do medicine. So I would say I had been doing virtual visits or visits from home or through Zoom quite frequently, actually, in part of my regular practice. But once the pandemic hit, I saw an uptick pretty precipitously in the number of visits I was doing. So I think the interesting things are, how do you provide appropriate care if I can't do a physical exam, right? Because that person is not with me. And so what's that going to look like in the future? I think as we start to think about population health and taking care of, large communities of people rather than a fee-for-service model, which is, how medicine has operated for a number of years, that will be interesting when we're starting to think about reimbursement and how, hospital systems will actually get paid for the things that they do. And then I think beyond that, how do you incorporate all of the new information and data that comes out? So there are thousands of studies, right, that come out probably on a weekly basis that I certainly don't have the capacity to keep up with. So what does machine learning look like? How could, things like Google or Watson help us, right, sift through a lot of this data and make better decisions for patients? And then what will, physicians' roles be in those, decision-making processes, and how does that work? So I think those are the things that your generation is certainly, I think, going to have to face. But I think over, the next 15 or 20 years, you're going to see a pretty significant uptick in just technology and machine learning and how we can incorporate that into the medical decisions we make on a day-to-day basis.
So right now, with hospitals reopening and patients are able to go back in for consultations, do you guys still do online ones, or have you mostly transitioned back to in-person?
Yeah, so we've found here, at least our internal numbers, it looks like about 15 to 20% of our patient panels typically prefer virtual visits. And again, I think there's a lot of things that you can do in a virtual visit that are helpful. So if it's things like, you're reliable and you take your blood pressures at home and you're sharing those results, we can make some of those changes, right, without you necessarily needing to see me. And then we could also, right, obtain lab work and then talk about what those results look like in terms of management for other chronic diseases, high cholesterol, diabetes, those types of things. And even obviously in platforms like this, I'm able to evaluate skin rashes, right? I'm able to see, some physical exam aspects that I can make decisions based on. So I think you're going to see and continue to see at least a portion of people's practices virtual. But I think, and I think it is generational as well, where I think some of my patients just don't have access to computers or access to smartphones with video technology where they're comfortable using it. So often, right, in those cases, they still feel comfortable, right, coming to the office and really want somebody to examine them just because they're not facile with some of those other technologies.
Yeah, so do you think online consultations will stay pretty relevant? Because I think it would also be very helpful for those who don't really have access to transportation or just are unable to.
So I do. I mean, even here, right, when it's cold, transportation is an issue, right? We get a lot of cancellations or things like that. Interestingly, there's already technology out there where you can get a kit for, a few $100s that has Bluetooth capable technology where you can actually check your vitals. You can look in your ears, you can look in your throat, right? And I could see that on this end. So you're already starting to be able to deliver physical exam skills at home. I think it's how to do that in a cost-effective way. And if you can do that, you could imagine, right, you're going to save a lot of money in terms of space, in terms of, how that would look in terms of interactions, where really then only you could imagine going in for procedures or surgeries or something that, that's going to be more substantial.
So for students entering in this field, what steps would you recommend that they take?
So that's a loaded question.
Yeah.
So I do sit on our admissions committee for Cleveland Clinic Learner College of Medicine. So I do review a lot of collegiate applications, right, who are people applying to med school. I would say at a minimum, right, your GPA and the objective measures like your MCAT score are still really important. They're not the only thing, but I would say you at least have to have those minimum requirements to get your foot in the door. Because I think, and if that requires you to take the MCAT a few different times to achieve that score, I think that would be my advice, is make sure you get there. Because I think once you get to that place where you can get past at least, the initial screening, then, right, it becomes about what other experiences you have. And I think often people think more is better, right, where I'm involved in so many diverse things that's really going to be my ticket in. But I would say it's actually really where your passions are and what you can talk about intelligently in your interview or in your application, where there are people who certainly have research or community outreach or leadership positions that are really impressive and interesting, and maybe even they have a few different ones. But I think the people who really stand out are the people who say, this was something that I started, or this was something that I'm really passionate about, and you can tell they light up when they start speaking to you. And I think it's those meaningful aspects of what you're doing, because that stuff's for you, right? It looks great on an application, but I would say, and this would be more advice, I guess, do the things that you find interesting that it may not necessarily help the rest of your life, because this is really the only time I think that you're going to get to explore it. Where, right, I think if you get into a professional career quickly or a job right out of college, you have less opportunity then to ask questions or to do something that maybe you hadn't considered previously. People who tend to take a year or two off, right, and they do research or they travel or they do both, those people have really interesting stories, and I think just a maturity about them that's a little bit different. So I know all of us are anxious, right, to just get on with your life, right? But if you think about it, life is obviously happening where you're at. So I think be there, be present, and really, get into some things that maybe you wouldn't have considered previously.
Yeah, that's really great advice. Because on a smaller level, when applying for colleges, we had to list a bunch of extracurriculars, and I found myself kind of scrambling to think about what I could do to make my application look good, I guess. But what I found was that I actually had a lot of things to list that I naturally was doing over the course of my high school years. So I think it was really interesting to see how my own personal interests helped build my extracurricular list that I didn't even think it would really help.
And I think the other thing is we put such an emphasis on the opportunities and the doors that are opened by getting into an elite college.
Yeah.
I don't want to minimize that, because there's obviously, and this is going to sound trite, and obviously when we're on a video like this, I have to censor myself to a degree, but I would say, you're not paying for Harvard, right?
Yeah.
In terms of the education that you're going to get there. I think other Ivy League schools or even non-Ivy League schools that are elite are still going to provide a very similar background in terms of your overall education. But what you're paying for, right, is the degree and the opportunities that degree then opens up, right? So post-college. So I would take it with a grain of salt, because I think everybody senses a disappointment if they don't get their first choice, or if they're not at that place that they envision will make or break the rest of their life. But especially having done this now, I mean, we have physicians, colleagues, support staff who come from all different backgrounds, and they get to the same place that I do in a lot of different ways. So I don't think you necessarily need to say, if I don't get into Stanford, right, I'm not going to be able to then have the rest of my life where I want it to be.
So do you believe that there are any specific personal attributes that help people become successful in your field? And what would you constitute as success in your career path?
That's actually a really great question. And I know you sent them before, so I should have already reflected on this. But what I would say, so the first part of the question is easy for me.
Yeah.
So we talked a little bit about communication, but I think the thing that actually sets people who are successful, at least in medicine, apart is their ability for introspection. I think, like anything in life, feedback can be really powerful. But I think it's those people who really take feedback at different steps along the way to heart and reflect on it in a meaningful way are the ones who are the most successful. So whether that's, physical exam skills that you could improve upon, an interaction that you have, or, some behavioral type stuff that may need to be changed to make you a better physician, I think it's the people who really spend the time to say, let me be introspective about this and think about it, and then really decide, if that feedback's appropriate and do I want to act on it and change my behaviors. Those are the people who I think are most successful. And I think that's true of probably any career field that you go into, where I think it's just that ability to respond effectively to feedback is the thing that sets people apart here. In terms of success, I mean, success means so many things, so many different things to so many different people. For me, I think, a lot of it is patient satisfaction. So I think having that interaction with me and they felt like they got something out of it, right? Whether it was, their emotional well-being, whether it was a diagnosis we made, whether it was just help navigating an issue that they had, that has medical aspects to it. That, I think, to me is success. I think you can measure it in a lot of ways, right? Titles are big in medicine, as you heard at the beginning. So I think, as you move up the chain in academics, right, becoming a full professor of medicine is the aspiration for those involved in research. I think, becoming the chair of a department, the president of a hospital, the CEO, all those things, right, I think would be considered successful. But I think any physician would tell you at the end of the day, it's really about their clinical practice first, because that's why we all got into this, right, is to take care of patients. So I think if anybody told you, hey, and they were another colleague or another physician, they said, I would actually want you to take care of my family members, or I respect, you as a clinician, I think that's probably the highest level of just satisfaction and respect and the thought about being successful it gets probably.
Yeah, and with that, I think it's really cool to think about because often we don't realize how integrated physicians are actually with our lives until we actually think back to the impact they've made. So, what do you think is the best piece of advice that you have received?
So I love this quote. So this is William Ward. So he actually did a lot. He was an author. He wrote a lot for Reader's Digest in kind of the 1900s there. So his quote is, failure should be our teacher, not our undertaker. It is delay, not defeat. It is temporary detour, not a dead-end street. And I love that quote for a lot of reasons, right? Because, failure is something that I think I did not handle well, particularly right when I was in high school, but I think even in your collegiate years, you see it as, a setback or something that you don't see it as a learning opportunity all the time. And I think that's really something that has changed in terms of my mindset overall, where I think I'm much more confident in failing because I know that that's going to be a lesson that I learn for whatever I've failed at. Whether it's, clinically in my professional career, whether it's in personal relationships, all those things, right, I think are really important and build you and your character and how you are in the world. And I think it really, I was probably quicker to anger when I was younger, and I would say a little less receptive to feedback, right? And probably less closed or more closed-minded and less open to new things. And I think that as I've gotten these different experiences and I think learned to use those failures to change my behaviors and to really try to improve in whatever area it may be, that's what I think I value, and I think I see the value in it now.
Yeah, because I definitely think that failure has such a negative view, but it's definitely something that I think should be taken as something that's more positive. But it's always hard to think that way in the moment.
And it depends on the scale too, right?
Yeah,
I think
that's true.
particularly, right, when it's GPA related, right? Whether it's a test or something, right, or on the athletic field, it's on such a micro scale at that moment, but you don't appreciate that when you're in that moment because you haven't had those experiences to know, what are those other things that are going to come along that will be my successes and failures.
What advice would you give your younger self when you were first starting your career? Or is there something that you wish someone would have told you before you entered this field?
Find an emotional outlet. And whatever that is, embrace it and use it often. Because I think medicine can be emotionally exhausting, where, certainly there's, they talk about compartmentalizing and trying not to take work home with you. And I think that's something as physicians we really struggle with. I think often, right, we really ruminate on our failures and things that we could have done differently when there's a bad outcome, even if it necessarily wasn't a mistake or within our locus of control. I think those are things that really weigh on you. So I probably would have told my younger self, and even obviously maybe even earlier than medical school, you need to find an outlet for that. So whatever that is, right? Whatever hobby, whatever, relationships that you value, and using that, right, as a way to kind of help you get away from it all. That would be, I think, my big piece of advice to my younger self.
Yeah, that's a really good piece of advice, because often a lot of people tell me that you need to have a creative outlet no matter what you decide to do in life. And I think that's very valuable.
Well, and there's a lot of lip service nowadays to things like wellness and burnout and
Yeah.
what that means. And I think, there's rightly so a lot of research, and there's a lot of stuff that has come out, regarding that. For me, I think it's really taking that practical step, right? Making it a real tangible thing for you. And that's the important piece, whatever that is. And sometimes you need breaks from everything, right? I mean, sometimes it is, family strife or relationships. Sometimes it is professional. Sometimes it's spiritual. So I think, right, there are different aspects of your life that you're going to find that there's got to be something that you can come back to, or a few different things that you have interests in that really just allow you to get away and kind of unplug.
What experiences would you say most prepared you for this career?
I would say more small group learning, probably in college more than anything else. I think, in the beginning, those large didactic classes that are just test-based probably prepare you to a degree in terms of the knowledge that you would need for the MCATs, or right, even your early career in terms of biochemistry and some of those things that you would normally do. But for me, I think it's just, how do you interact with others, and what type of team player are you? As you move through your career, and it may be medicine, it may be something else, you'll realize that it's not you alone. It's always as part of a larger cohort, right? So whether that's people that you work with directly every day or part of a larger organization, the teamwork aspect of it and your ability to work within a team and acknowledge other people's successes, and I think your failures and successes, is really critical. So I think it's really about how you interact with colleagues and with peers in a team format, because that's really what is going to help you be successful.
Would you say that there was a certain experience that made you realize that internal medicine was what you wanted to pursue?
Yes. So this is one of the points I was actually hoping we would get to, so I could make. When I was actually a medical student, one of the fields that I was really interested in was urology. So urology, right, the study of the genitourinary system, you spend a lot of time in the outpatient setting, but a lot of time doing procedures and in the operating room. And I had spent a lot of time doing some acting internships in urology in a couple of different areas. And that was the thing that I thought that I was going to really go into in my career, because I really enjoyed talking, and especially because I spent time at a VA hospital, a lot of the veterans, just about men's health. And I think that was really something that was a lot of fun for me. When I was actually making the decision, so my now wife, who wasn't my wife at the time, had actually brought up to me, it's so interesting. You really love being in the outpatient ambulatory setting, talking to patients, but every time you have a day that you're in the OR or a day that you're in the procedures, you're really crabby and kind of not the most energetic and nicest person in the world. And I think that was her gentle way of saying, maybe you should consider something else, or how that would look different. And I think it was really eye-opening for me, because you don't necessarily perceive yourself like that right in the moment. And so I think when someone else presents that information to you, it's their perception. And I think that's something that obviously I very much valued her opinion. So when I had heard that, I said, wow, that's really interesting, because I had not thought about that really, significantly at that point in my career. So I really took that to heart over the last couple of weeks of a rotation that I had in urology. And I said, she's right. I really actually don't necessarily like this. What could I be doing differently? So medicine was something I think I was always interested in, just from the cerebral aspect of it, and trying to, think about diagnoses and trying to make use of all the information that you have in terms of, a formal diagnosis and treatment plan. So I was very late to actually applying to medicine in general, but was able to get a couple of my mentors to write me letters of recommendation. And that's actually ended up how I applied to internal medicine rather than urology, was really the advice that she, and the perspective that she provided. So I would say one of my big pieces of advice here would be, however you make decisions, decide how you do that early on. Whether it's, trusted people in your life that you usually run things by to try to help you see a different perspective, whether it's, pros and cons lists, whether it's experiential where you just have to experience it and see whether you like it or not. Because I think if she had not said that, I probably would have just applied to urology and been miserable, in the OR for a few years while I was a resident, until I was able to get out and practice and, kind of define what I wanted out of that. So, I think that's really what I would say to my younger self, but also I think to people who are not sure or, kind of hesitant, is however you make decisions, that's really a critical piece of who you are and what you do moving forward. So make sure that you know how you do that and make sure that you trust that process.
With that, what did a typical day being a resident look like? And how does a typical day look like for you now?
Yeah, so being a resident was exhausting. And I think anybody would tell you that, where it's long hours in the hospital. It's mostly inpatient based, although you do have, outpatient opportunities as a resident. But basically every 4 weeks you're doing something different in a different subspecialty of medicine. So whether that be cardiology or hepatology or endocrinology, those types of things. It ebbs and flows, right? You have time for research, you do get some vacation time, but I think generally you're exhausted and busy because you're trying to learn all the things that you need to be an effective physician. And there's only limited amount of time, right, to be able to do that. As a attending physician now, right, I think I wish I asked more questions, certainly, as a resident, because I think, not that you can't ask, because colleagues are certainly helpful if you have questions about specific things, but I think, you're less confident in being able to do that. There are definitely areas of medicine which I wish I had learned a little bit better, because then maybe I would consult other physicians less, or you make better decisions. And then you always have resources at your disposal to help, but I think that would be one of the things that I would say. When you transition to an attending physician, I wouldn't say that it's less work, I would say it's just different. In the sense that you probably have more responsibility and you feel that responsibility more because you are making those decisions without any supervision. And so from that perspective, I think it's just different in terms of the amount of work that you do. Typical week for me now, Monday mornings is my own private clinic with patients. And then in the afternoon, I actually supervise a second-year medical student. Then on Tuesdays, I'm in my executive health practice. And my executive health practice is a little bit different than my primary care practice. So typically those patients are part of larger corporations who want their executives to come through to make sure that their health is in good shape. There's certainly people who are just interested in getting a more comprehensive look at their overall health from the perspective of, lab work and diagnostic imaging. So they look to that as that outlet. And I would say we partner with a lot of different individuals and organizations throughout the country. So one of the things we do, at least in our program, we see a lot of ex-NFL players, because the NFL Trust actually partners with us as one of the hospitals where they send NFL players who have had so many years in the league, who now obviously want to make sure that their health is in good shape, especially with all the things that we're learning about cerebrovascular disease and the trauma that can affect obviously mood and neurological symptoms. So that's something that we've done, and that's been really interesting. So I do that usually on Tuesdays and Fridays, full day. Wednesday morning, I have a third-year medical student that I work with. And then Wednesday afternoon is my own virtual clinic. So I see all my patients virtually. And then Thursday morning, I have resident clinic. And then Thursday afternoon, I have off for administrative time. So every day I do something a little bit different. And then 10 weeks a year, all of that stuff is on hold, and I get to be in the inpatient setting, taking care of patients in the hospital with a team of residents. I think one of the things that really attracted me to medicine was the variety. So the fact that you can do something different every half day or every day, or even throughout the other roles that I have, right, within education, in the medical school, or the residency program, or my role as medical director for Health Network. There's a lot of opportunities that are afforded to you in a lot of different ways that you can get involved with. And I think you just decide the things that you're interested in and really can go in a lot of different directions.
Yeah, that's really interesting because I know I used to watch those like medical shows, and they always depicted being a physician as being the same thing every day. But hearing that there's so much variety is really interesting.
Scrubs is the most accurate medical show.
Okay, I'll watch that then. So when you were in college or even a resident, were there times where you kind of doubted the path you were taking because of how daunting the many years of school looked?
All the time. I still do, right? I think everybody does at different points, because Right, the grass is always greener on the other side when you look at other people that you want to emulate or you want to be. And you hear obviously stories of classmates or people who have gone on to do different things with their career, and you say, oh, that's interesting. I would have liked to get involved with something like that. So I would say, yeah, throughout college, were there certainly times where I said maybe medicine's not for me.
Yeah.
I did that certainly in medical school and residency, and even now. And I think, right, that's natural to think that way. I think ultimately it's, you have to do this for quite a long time.
Mm-hmm.
So is it something you're passionate about? Can you fit it within the rest of the goals that you have for your life? And right, is it something that you see yourself doing, day in and day out? So for me, one of the things that we really like to do as a family is travel. So, that's a big aspect. Obviously, COVID has put a huge damper on that. But we've been to a lot of different countries. So that's something I like to do outside of work. I picked up golf, so I like to do that. My wife bought me a guitar, so I'm trying to learn how to play the guitar, although that's going very poorly because I just don't have time for it. So I think, there's other things, obviously, outside of your professional identity that are going to be meaningful to you. And I think as you start to develop, those different things that you really, have a passion for, you're going to see that the things that you prioritize, are the things really that you want to continue to pursue.
Well, I think that about wraps up all the questions I have. Is there anything else that you would like to add that we haven't discussed?
One thing that I will say that I have not yet. So Jerry Izzo had a pretty profound impact on my just love of history when he was at Academy. I know he's since left, and I think he moved down to Florida. So, that was obviously somebody who I, very much admired, and I think was one of the reasons even that I pursued history in college as well. So I just wanted to give a shout out to him because I very much appreciated the time that he spent with me, and probably reluctantly so at times, right? It was probably more difficult back then than I am now. The nice thing is you certainly can be confident, obviously, at the Academy because they've been for a number of years, but I think the nice thing is you do really feel well prepared for college, I think, comparatively. Certainly, obviously, friends that you make in college have a lot of varied backgrounds and places that they come from. And I would say, actually, the people who had gone to Academy, and just as a group, obviously, I still am in touch with, would say that we definitely prepared them well.
Yeah, I definitely think that at Academy, you build closer relationships with your teachers. And I'm hoping that, or I have a brother that's in college, and he says that it makes it easier to reach out to professors. Like, he doesn't feel as anxious if he needs help.
The way that they operate is very much like a college
for sure
atmosphere in terms of the approachability, where I would say, certainly, obviously, now it wouldn't be an issue, but I think even in college, right, you're less hesitant to make those relationships and build them, right? I mean, there are definitely professors, obviously, who I have who I still do actually quite a few things with outside of, my professional obligations. One of the things I do is history associates. And so that's actually really, it brings a lot of great programming in terms of really circulating professors around the country who come in and give lectures, and we do a lot of fundraising as well. And I would say those relationships started in college. And then I think it's been nicer, right? Because I think in my professional capacity, I've been able to give back a little bit more now.
Yeah, well, thank you for being here. It means a lot for giving us such a valuable perspective. And it was really interesting to learn about all your experiences and how it shaped your path.
And happy to be here, and thanks for having me. I would say too, if people have questions, specifically about medicine or what, certainly would be more than happy to answer those. So there is a follow-up opportunity, or even if people want to contact me directly, I would be more than happy, obviously, to entertain.